That's good to know. Let's talk about the treatment a little bit and the treatment options. So I know you guys take a very unique approach at the Motherhood Center, and one that I think is really starting to get a lot of attention, much deserved attention. So I'd love for you to talk about kind of how you approach treatment, and what that looks like and what the scope of treatment looks like. What are all the options?
So we approach treatment for perinatal mood and anxiety disorders based on the acuity of the symptoms. So our standard practice is every new and expecting mom who's symptomatic comes in for a 90-minute evaluation. And it's at that point that we determine the best course of care and treatment for her to get better faster. So we offer everything from PMADS support groups here twice a week for new and expecting moms to kind of drop in, see the space. These are women that might not have told anybody yet that they're in distress. And oftentimes that one support group either allows them to feel so much relief because they're around other women that are openly talking about how challenging this is, or they're like, oh, wow, I see the place. I feel comfortable here. I think I might need a higher level of care. So what that looks like is outpatient therapy. We have social workers, we have psychologists, we have mental health counselors that specialize in perinatal mental health. And then we have reproductive psychiatrists here. And they differ from general psychiatrists because they specialize in providing psychiatry to women that are pregnant and postpartum. So they are very well versed in what medications are safe to use during pregnancy and postpartum. And then the level of care that we offer, which is offered nowhere else in New York City and only a handful of other places around the US offer, is this partial hospitalization program. We call it the DAY program. And this is for pregnant and new moms that are having a very, very difficult time caring for themselves and or the baby. They come here 5 days a week, 5 hours a day. We have an on-site nursery. They participate in therapeutic support groups with other women. They're all followed by an individual therapist and reproductive psychiatrist for medication. And we do dyadic work. So we have therapists that specialize in the mother-baby relationship. So they can work with moms on how to feel more comfortable separating from the baby, or if a mom is having difficulty bonding or attachment with the baby, how to practice feeling closer and improving that bond and attachment with the baby. Moms are here with us in the DAY program anywhere from 4 to 6 weeks, but I cannot tell you how amazing it is to see a woman come in on her first day of the DAY program and, cry most of the time or hardly say anything, slowly grow and come out of her shell. And by the time that it's time for her to discharge, nobody ever wants to leave because this becomes their womb, literally. But to see the amount of drastic improvement that these women get to experience and really start to enjoy their pregnancy or becoming a mother, there's nothing like it. It's magic.
That's amazing.